welcome to Legal Affairs. My name is Diamond Liddy, and I'm the public defender of the 19th Judicial Circuit. We have a wonderful show. I know I always say that, but we do. Another great show with a very dear friend of mine who is also the executive director of the Hands Clinic. Now, some of you may say, what in the heck is the Hands Clinic? We're going to find out all about it today. And also with him is Irvin Valken, right, who is a registered dental hygienist with the Hands Clinic. But before we get into all of that and some of the cool things that are going on with the Hands Clinic and the St. Lucie County school system, Andy, let's start with you. You just became the executive director of the clinic, correct?
Yeah, back in June.
Okay.
Yeah, yep.
Now, let's back up because
Sure.
some of our viewers really don't know what in the heck the Hands Clinic is.
Sure.
So tell us, what is the Hands Clinic? When did it get started? What does HANDS stand for, by the way? I don't know.
Health Access Network Delivery System.
Okay, okay.
Yeah. It began actually 4 years ago this past October.
Okay.
It was formed by a coalition of healthcare providers, community organizers, and representatives of community agencies because they realized and recognized that there was and is a serious problem in this county regarding the medically uninsured.
Right.
We have about 50,000 people right now, 50,000
Wow.
without health insurance, and actually about 28,000 of those folks have jobs. These are adults we're speaking of.
Right, right.
So based on that, they created this clinic and got it funded through grants. They come from the low-income pool grant. It funds most of it, and unfortunately that grant is probably going to be disappearing. It's funded by the federal government through the state government, but because of the Affordable Care Act and the theory behind that being that people without insurance would then be able to afford it and or wind up on Medicaid, the government is going to start taking that money back or just figure that we don't need it.
Oh, boy.
And I'm sure there are some states that don't.
Right.
But however, this isn't one of them. We do need it.
Okay.
So it's been running for the past 4 years. It's a primary care clinic. It has general medicine. We also have dentistry, adult dentistry in the clinic. We have mental health services there.
Right.
We also have referrals to specialists who have also volunteer for us.
Right.
So there are, we have a ophthalmologist that comes in, and we have orthopedics and so forth. These are all physicians who volunteered their time and either see the patient in our clinic or the patient is referred to their office. The hospitals also participate with us by providing our laboratory services for us.
Oh, boy.
Yeah, and over the past 4 years, that's amounted to about $26 million worth of service. So they do that, and they also provide direct hospitalization in some cases. Cancer care, although we get some support for that. The hospitals have been very forgiving in taking patients with cancer.
Right.
In addition to that, Moffitt over in the West Coast has taken several of our patients for cancer therapy, and I guess their value of what they've contributed is around $8 or $9 million so far in cancer therapy.
Goodness.
Yeah, so it's been a community effort.
Now, where is the clinic located?
Yeah, the clinic is located at 3855 South Highway 1. Most folks will know it because it's the old Sam's Club.
Right, right.
Yeah, the old Sam's Club. The sign out front, the big sign, says St. Lucie County Logistics Center.
Right.
But there's a little
if
sign.
If you go back in,
there's a little sign on the street that says Hands Clinic. But we're pretty prominent. Once you get up to the building, you'll see our sign. So we have right now about 3,400 patients on our rolls.
Oh my gosh!
We lose some. Some graduate to Medicare. Again, to be eligible in our clinic, you have to have no insurance at all. If you have insurance, we can't take you. So it's for uninsured adults
Well, now what about an income level?
Yes.
If I'm living in a fancy house but I have no insurance,
No,
can I come to...
That doesn't work.
Right, okay.
It's 200% of the poverty level.
Okay.
And we do require verification of that.
Right.
Although this is a self-declared state in terms of income, the hospitals, for their part of their care, are going to require that. So we ask people to bring in a tax statement or a letter of non-filing, if that's what happened.
Right.
Yeah, so it's 200% of the poverty level, federal poverty level. And again, they're for adults. Some people, will be with us until they reach 65, then go on a Medicare.
Right.
So.
Well, now you do help some, and that's, Irvin, where you come in. We're going to get to you in a second.
Yeah. Yes, he's a very big component of what we do.
I know. But it is the only component of hands that involves children is the dentistry? Or
yes. No, it's only the dental program, and it's not in the clinic itself. We don't have a pediatric dentist in the clinic. In fact, we don't have that many dentists.
Right.
Although we have lots of patients who need dental help.
I know.
Yeah,
we do.
We do, and unfortunately, we don't have enough dentists, and pediatrics is one area where we don't have anybody. But Irvin's program is outside in the schools, and actually what he does in terms of, and of course he's going to speak for himself in a second, but what he does is the basics of public health. He's in there on the front line trying to not only identify children with issues, but also to do preventative services.
I was going to say, on the prevention end of it. Well, before we get to you, Irvin, Andy, where the heck you're executive director.
Yeah.
What and I know you were kind of solicited or whatever.
Drafted,
yeah, got drafted, but which was a great choice, believe me.
Yeah.
But briefly, give us your background. How did you get involved with this?
Well, I got involved with this because of you, actually. Well, I'm a retired hospital administrator. I have been in the service for 22 years as first a pharmacist and then a health administrator. And then when I retired, I ran 2 civilian hospitals in New York. Came here and retired, I thought, and I got involved in some community activities.
Right.
I currently chair the board of Treasure Coast Hospice. I have one more year doing that, and I've been with them for 4 years. How I got involved with hands is through mustard seed.
Right.
Stacy Malinowski contacted me, and the reason she even knew me was because my house was used, at, I think my neighbor Diamond's request, on one of the mustard seed fundraisers. And so when she was there with the group from her place, she got chatting with me about what I did and so forth, and I told her what I was, and she
realized how uniquely qualified you were.
Well,
oh no, I mean, are you kidding me?
Yeah, well, I don't know, but anyway, she shortly thereafter contacted me and said they were going to be making some changes in the clinic, and asked if I had any interest, and I initially said, well, I'll help you out for a short period of time. But you know what happened? I got up there, and I got really, I got hooked because of the, I think the mission. The mission is so important.
Yeah.
That I looked at it, and I hear my office is right very close to the front. I did that on purpose because I like to hear what some of the patients have to say when they come in initially.
Right.
Not of course for their medical care, but when they're being certified. And some of the stories that you hear they're heart-wrenching.
Yeah.
And so I got to thinking about this, and I said, well, so long as I'm feeling well, I'm gonna stay. So that's how they got me. And here I am.
And thank goodness for that.
Well, I don't know. Well, hopefully.
Yeah.
Okay, now, Irvin, I know you've been patiently waiting. How long have you been involved with the Hands Clinic?
I've been involved for about 4 years.
Oh, okay, since the onset.
Yes, since the onset of the program. So basically, how it all started, there was a lot of nurses in the school nurses, and a lot of people in the community saying, you know what? They found that there was a lot of children that were in the clinics complaining of dental pain, A lot of children had issues, and it was difficult getting it resolved. So what happened in 2008?
Well, let's back up a
back up,
second.
back up.
Now,
Right.
and this is my fault.
Yeah.
How long have you been a dental hygienist?
Since 2007.
Okay, and
2007.
you worked in a.
Well, I worked in, before this, I worked in private offices.
Okay,
and I was living down south.
Okay, God bless you.
Yeah.
So anyway,
yeah.
so you got involved with hands.
Yeah.
And, so go ahead. I'm sorry.
Yeah. So I got involved with hands, and it was actually pretty funny. I was at home, and I just saw the ad for the title. I was like, this looks interesting. It's different, very interesting. So I looked at it and I said to my wife, I said, what do you think? She's like, apply, see what happens. So I went ahead and I applied and I interviewed, and I love kids, so I'm kind of a kid at heart, people would say. So I kind of interviewed and did well and got the job. So when I first started, I was kind of new because we just bought a house here. I was kind of new to the whole community. I wasn't familiar with really pretty much anything. So I kind of came in. I was just kind of like, okay, I'll see kind of how this came about, how it happened. And one of the nurses that was the head of getting it started, Elizabeth Pantano, from the health department, she was kind of guiding me, telling me the ropes and where to go and blah, blah, and so forth. So it all started, and well, let me also go back to why it started. So, like I said, there was a lot of issues. A lot of people were saying, and kids weren't getting help. So they did some dental screenings. A dentist did some dental screenings in about 8 different schools. They did some third graders. And
Is this all through hands or
no,
another?
this was before. This is 2008, before the program.
Okay.
So this is how we got to this point. So they found that almost half of the children had cavities that they screened. So 50% of children had some kind of decay. So it's a pretty high number. So what happened was they the people started getting things together and saying we have to make a difference and blah, blah, and so forth. So then the Hands Pediatric Dental Program came about. They bought a Children's Services Council, and United Way funds us. They did they bought some equipment, and I got hired. So we started, I remember the day, September 27th, 2010. Never forget it. Remember that day we first started. And we went to our first school. And I was completely surprised because the way we picked schools was we did it through free and reduced lunch. So the highest, free and reduced lunch was the schools we went to first initially. So the first 2 schools we went to, we saw that 50% decay rate. So and we saw that we saw 25% referral rate needed for preventive services. So 75% of those first 2 schools needed to be referred for some type of dental issues.
Well, okay, let's back up again. So you went to the first school.
Yeah.
And what, everybody filed down into a room and you opened them and looked at them?
It was really funny. So when we first started, because it was just made from scratch. I pretty much developed everything that we do now, all the process, everything. From the forms and everything. So it's kind of just from scratch. When we first started, we didn't even have the equipment yet. We didn't have equipment. We didn't pull the equipment out yet. So we came in and we had a little chair. We had Lauren. She works at the health department, kind of help out for the meantime. We had a little light and we were looking, and it was just kind of,
So that was, oh my gosh. Well, Andy, you were bragging on him before. That's why we.
It was brand new. Everything.
But 50% of that first school had tooth decay.
Yes.
Okay. So then what happened?
So then we go, oh my goodness. Wow. It was surprising to me because I'm not familiar with the type of issues that they had.
Right, right. You're used to polishing good teeth and
not always, but yeah. For the most part, yeah. So we get there and we're like, wow, okay. So, and then first thing we do is we say, all right, we need to refer them to their local provider. So we refer them to their local provider. And guess what? We looked at it and, a lot of the, parents weren't going. Well, we looked at the providers and we said, oh my goodness, well, they can't get patients in. They have to wait this much months, and they had so many issues. And they had the Medicaid system was kind of difficult for people to understand because there was different places that took different types of Medicaid. So then we were like, okay, let's educate ourselves on how this works. Let's do this. So it was a real process.
Right.
A process for us to see what works, what doesn't work, how we can get the letters out to the parents, the best things we can do to educate the parents, to educate the students, on dental care, and you don't have to go when something hurts. You should go every 6 months and so forth.
Right.
So, through the years, we developed processes where we can expediently navigate people for dental care. So, as of right now, when we see somebody that has an emergency, we can get them an appointment that same day.
Really? Where?
Yes. Now, what we have developed through the years is several partnerships.
Oh,
we have a very
okay.
big partnership with the health department. We do a lot of our referrals there. Most of the children qualify for Medicaid, and they're one of the providers.
Right.
Now, there's several other local providers out there that take Medicaid in different types. So what we do is, before we screen, we look up what insurance they have. So we say, okay, you have this insurance, you have this issue, you can go here. Or you need to go every 6 months if you're okay.
Right.
Now, we also do have several children that need to reapply for that. We also provide services with that, help them reapply. We have children that do not have insurance and will not qualify for insurance. So this is where we have a lot of relationship with dentists in the health department, Florida Community Health Center, Dr. Dermody in Vero Beach, Dr. Castro and Sebastian, Dr. Arline. So we have several different dentists that we've worked with, Dr. DeTorian and Stewart, specialists that we can refer them to them, and they'll take care of our patients.
Oh.
They'll give us discounted rates. We do have some funding for children that can't afford it. We go ahead and we will pay for some of those services at a discounted rate. So,
well, are you still, Irving, going into the schools to check them?
yes. Now, that's the one of the main things we do. So we go to, we're at 13 schools right now. We screen pre-K to second grade, okay, at the elementary schools.
Right.
And then we're also in Dan McCarty, and we do a 6th grade there, and we're also in Dale Castles. We do 6 to 12 there. And what we do is we do an oral examination. We screen them, we ask them some history, and then we examine, their oral condition. And then from then...
Well, you don't do this single-handedly, do you?
Well, initially I did. Well, I always... Initially,
Mostly him.
Yeah. What we did before was we had some of the nurses, as, they had time to kind of come with me and kind of organize them. I do have an assistant now, Pat Johnson, so now, which helps a lot because she helps a lot with the paperwork.
Right.
So she kind of comes in and she organizes the kids and asks the questions for me to kind of have them help me navigate them through, and I screen them.
Wow.
So, in addition to that, we also do education. We do a presentation with the children about brushing, what are cavities. We have a
I'm sure so many of these children, no one's shown them how to floss their teeth, how to
how long
brush.
should it take, what is a dentist, what is toothpaste, all these different things. So we, what we have is we have educational videos. I try to make it fun for them because when you make things fun for kids, they learn, and they like it better, and they retain it more easier. So we do it. We have several educational videos where they have like a cartoon, the dental defenders and stuff like that. So they come in, they show them that. And the good thing about the cartoons is it actually entertains them. Also, it gives them all the points they need to know. How often you should go to the dentist, they should be brushing. So then after that, we go ahead and I do a little presentation with them. I go over on a PowerPoint presentation. I go through and, educate them. Then I ask them questions and I give little prizes, to make them more excited to answer the questions, so they get the education that way.
Well, let's back up though. Okay, so you're obviously you're educating the children.
Yeah.
Then you're doing the screening to see if they need, and if so, you refer them.
Yeah.
But give me I'm having a disconnect with your promotion of getting your teeth cleaned every 6 months.
Yes.
That's when they would come to the hands clinic and get.
The way it works is we actually look at all of them individually. So we look at if they have, if they have insurance, if they don't have insurance. Now, sometimes we can't always look at some of the private insurances. We can't tell. If they have healthy kids, we can't tell. So they get a letter at home stating your child is in good oral condition. Please make sure you take a child every 6 months.
Right.
This is a screening, blah, blah, and so forth, okay? Now, we have several categories they go into, 1 through 4, and 4 is the good oral condition. Now, if they go to the other categories, where they have either emergency, have one or more cavities, or need preventive care,
right,
we send a letter. We, if they don't have insurance, we give them a call. We actually, if they're 1 through 3, give them a call regardless. So after we send that out, what we do is We give them a call to make sure if they've been to a dentist, if they need help, and so forth. And, you know, we find a lot of people that don't have transportation, a lot of people that say this and that.
There's so many roadblocks.
And when we're not sure what insurance they have, if it doesn't come up that they have insurance, for some reason, we call and see, you know, is your insurance coming up? Do you have private insurance? We pretty much, we've worked with people that have insurance, but it's so expensive they can't pay the rest. Like, for example, a couple of weeks ago, last week actually, we had a child from one of our early learning coalition centers.
Right.
The mom had private insurance. Well, it was going to cost a large sum of money with that insurance because the child needed to be sedated because she couldn't sit still, so they had to get an anesthesiologist to the office.
Oh my goodness!
So then, you know, she was able to cover. You know, it was like $200 something else, $300, but it was going to cost about $1,000 and change, and she couldn't do that, and so forth. So the kid was in pain and blah blah, and the kid was kind of sitting there waiting for it. Didn't get any pain medication, so I called and got him pain medication, and we actually covered the difference that the parent couldn't pay.
Right.
So we try to provide services for, you know, every situation, because just because somebody has insurance doesn't mean that they have everything they need.
Oh no.
So and in addition to the schools that we screen, I mean, obviously there's a lot more schools than we screen. So the policy that that I've adopted is a child's a child. So even if we don't go to the child doesn't go to school we screen, we still will help.
If they come into the clinic.
Well, not necessarily come to the clinic. All I have to do is give me a call. Well, if they come into the clinic at that school, yeah.
Right.
Yes. So we work closely with the nurses and the health parents in the school. So if anybody does have an issue, you know, everybody has my number. So usually they'll go ahead and give me a call, say, hey, I have an issue here, I have an issue there, and they'll give me a call. I mean, we've done a lot of stuff with schools that aren't even being screened, you know, schools that aren't being screened. We've done stuff with high school children in middle school, and so forth. So
wow.
It's
So the need is clearly there.
Oh, yes.
So, and how many schools right now are you able to?
Currently in 13.
Wow.
Now, this is 13 school board children. We also screen children with the Early Learning Coalition.
Right.
And last year we did 30 Early Learning Coalition centers. We also work with Head Start.
Oh, okay.
So we screen a lot of children with Head Start
and
from the ALPI program, yes.
And in the meantime, though, you're still in the hands clinic for some dental hygienist stuff.
Yes.
Too.
So what it is, it's just it's kind of like a big
umbrella.
Yes. Yeah. So I try to help out as much as we can. Sometimes when I do have time, which is not that often, but if I have a day here and there, I'll actually see some adult patients in the hands clinic because you know, we rely on volunteer dentists and volunteer hygienists.
Yeah.
So a lot of the protocol in dentistry is, you know, before you get any of your work done, unless it's an emergency, you need to make sure you clean their teeth. So if
even if they need further. Okay.
Yeah. So if there's no hygienist there,
right.
You know, I mean, so we gotta keep people on that maintenance to keep them healthy. Otherwise, they have the issues.
Well, your teeth. I mean, you can get really sick if you're having
absolutely.
Really.
It leads to heart disease and other serious.
Oh, absolutely.
Yeah, people don't realize.
Yeah.
Keeping teeth clean.
The same plaque you find in the arteries is the same plaque you have on your teeth.
Yeah.
So I mean, it's
the same plaque you have.
The same plaque you have on your teeth, as part of your teeth, is actually the same plaque that's in the arteries.
Oh, wow.
So there's actually a big connection between that.
Oh, gosh, you didn't really.
Yeah.
Well, now, you're not going to believe this, but we are just about out of time.
Yeah,
I told you it would fly. So I don't want to, first of all, oh my gosh, this is tremendous. You know, I didn't even, you try, being involved in the community and all the things, you always try to, have we missed anything? Is there something we need to address? I would no more have thought about dental.
Yeah.
You just don't think about it,
It's true.
If you actually heard some of the stories, people just take for granted. Some people don't have a toothbrush. Some people, they don't have a toothbrush at home, or they don't have toothpaste at home. I've had one cases where they were sharing a toothbrush.
Yeah,
I've had cases where, the parents are separated. I have it at my mom's house, so when I go on a weekend to dad's house, I don't have it, so you get we've had people that had cancer that, you know, they need oral surgery and they exhausted all their expenses and they have no money to do anything. Sometimes you see children that are really younger, they have very bowel decay. You know, they have their 20 teeth, 16 of them are decayed. I mean, you see a lot of different scenarios, a lot of different cases.
He's seen over 5,000 children.
Well, actually, we've seen 5,000 children last year, and this has been going on 4 years. So I mean, we're about 20,000 screenings and so forth.
Wow.
Yeah.
And he also has a program. Irvin, you might want to mention quickly about your sealant.
Okay, yes. So this year, well, I'm very excited, but this year we're doing dental sealants. We're doing free dental sealants.
Oh,
and
wow.
Basically what that
in
does,
the schools.
In the schools, yes.
Wow.
So what that does, it seals the first year molars, and we're also going to do the second year molars for older kids. So what that will do is that will actually protect those adult teeth while they're vulnerable at that time, and that'll help them down the road because when you look at especially the sixth graders and all the students, the most of the decay is in the molars. You find it all in the molars. We did dull casters last time. Every single one of those, well, almost every single one of them were in their first molars, their permanent teeth that they had decay. So that when you get that, you need root canals, then it gets very expensive, and then it needs to be redone. So you're doing that, you're really setting them up for the future down the road. So we're excited to be doing that. Yeah.
We've got about 2 minutes left. I know clearly, and I'm not trying to cut you off.
That's really fun.
I know that the clinic, obviously you're funded, you know, in
through
part
grants.
by the through grants and stuff. But there's obviously a need out there for private donations.
Oh, absolutely.
If a doctor sees this or a person wants to donate money to the clinic to help people, who do they contact you, Andy? And how do they do that?
Sure, they can contact me. We have a website they can go to. They can call me at 344-2548. I've just recruited Sydney Liebman to join me as my development director for the clinic because we do need a development program to offset the losses from these grants that are disappearing. Now, you know, the United Way helps us as much as they can. Allegheny Franciscan Ministries has helped us in the past. The Children's Services Council helps us. But these grants are small in comparison to the LIP grant, which is most of our funding. We run the clinic on less than $1 million a year,
which is extraordinary.
I mean, it's mostly volunteers, and you know, for the money, it's where they got their bang for their buck.
My goodness!
Because an ER visit, one visit to an emergency room is over $5,000 average in this county, according to the health department's data. We've had over 18,000 visits in the clinic since its inception. Not 18,000 patients, 18,000 visits.
Right. So multiply,
at $5,000 a visit, you're looking at $93 million.
Yeah.
I mean, and this is where these people would have eventually wound up. Maybe not when we got them because maybe they weren't sick enough, but down the road, you can bet your boots, those folks without insurance, their only recourse is to wind up in an emergency room. And usually by that time, you're looking at a possible admission. You're looking at the disease process that's way down the road. Further so far down the road that sometimes it's irreversible. I mean, you know, some people let things go until there's nothing we can do. So
they need your help. So
yes, the community has got to come and, you know, rally around this cause because it affects everybody.
Gotcha.
Yes, it does.
Thank you so much. Thank you.
Thank you very much for having us.
Your great work.
Thank you very much.
Thank you.
Yeah, thank you.
Thank you for having us.